Hi, this is Dr. Winters, and I want to share with you about the Winters model of health restoration. How you can take a complex health problem, maybe even something that nobody's been able to figure out, and apply systems to it and help a person get better. Oliver Wendell Holmes said I would give a fig for simplicity on this side of complexity, but I'd give my life for simplicity on the other side of complexity. Basically, I've done that. 30 years in practice, 3,000 hours of continuing education. That's just sitting in a classroom in some city, plus all the things that I've studied on my own. And I've boiled it down how to get people with chronic health problems down to the Winters model of health restoration. It's really pretty simple, but I'm going to share it with you in just a moment. I just want to share with you, I'm a bit tenacious on learning and accomplishing your health goals. I drive a white car, and few people know why I drive a white car. I drive a white car because it reminds me of going out in a blizzard so severe you couldn't see your hand in front of you. You had to tie ropes around us to be able to get to the barn to milk the cows. I grew up in northwest Iowa. Every time I get in that white car, it reminds me of who I am in pursuit of helping people get healthier. So I want to share with you this Winters model of health restoration, but first I need to share with you that medicine is the study of disease and what causes a man to die, and chiropractic is a study of health and what causes a man to live. Now, if I'm having a heart attack, I pretty much want to be at a hospital where people have studied how not to die. So that whole system has a place, but can you imagine walking in the emergency room and saying, I want to be healthy, I want to feel fantastic, I want to have the best mood ever, I want to have the greatest energy ever. Do they have anything for you at the emergency room? No. So there's different models. Another analogy would be fireman and carpenter. If you're going down the street and you're coming toward your house and all of a sudden you see smoke coming out of your house, and who would you call? Of course the fire department, because they're going to have the right tools, the right equipment, the right training to come put out the fire. But the next day, when part of the house is in shambles and needs to be rebuilt, who are you going to call? Not the fire department, you're going to call a carpenter to help you rebuild the house. I'm the carpenter. Now, in the Winters model of health restoration, it is so simple. We work with the brain, we work with the body, and we work with the brain-body connection. The brain, the body, getting the right nutrients into the body, getting the right toxins out of the body, and then the brain-body connection through our chiropractic. I'm going to share with you a bit on each of those pieces now. We live our entire life through our brain. Our entire experience of our existence, we live through our brain. Yet we don't pay attention to it so much. We deny when we have memory issues. We deny when we can't focus properly. We don't pay that much attention to our brains. We put off excuses for it. But we want to help our brain function better, because not only does our brain control our cognitive thinking issues, but part of the brain's job that we don't see is controlling all of our internal organs. Not only through messages to those organs, but keeping the tone or the balance right between the sympathetic nervous system, the stress response, and the parasympathetic nervous system that allows the organs to activate properly and heal properly. That's all controlled by our brain. Now our brain has a little brain called the cerebellum that sits on the back of the brain that controls balance, coordination of movements, and muscle tone. So when we examine you, we'll often be doing things like finger to nose, and checking your balance, checking how you coordinate movements. That'll tell us if one side is less coordinated than the other, then we'll know that that cerebellum is weaker. That can even have an issue for, if you're just coming to us for back pain, the cerebellum can have a big role in your back pain if it's weaker on one side. The left cerebellum fires to the right side of the brain, for example. We'll do testing for the right brain. We'll watch the eyes if they move like that when we move a red and white tape in front of you. Or we'll watch your eyes pursue to a target and see if they do that properly. Or we'll check strength or tone on that side of the body. There's many things that we can tell. We might have you cover an eye and reach out for a pin in your peripheral vision. Some places you'll be able to find it good, some places you'll struggle to find it. That's because of the weaker lobe of your brain. So if we can find out how the brain is unbalanced from left to right, we can help bring that into balance. Bringing that into balance does a whole lot for the nervous system in terms of helping not only thought issues, but that control of the nervous system, or that control of the organs by the nervous system. And so part of balancing the brain is balancing this left and right brain activity. And we can easily do that, and then we can give you exercises to do at home to strengthen those areas. For example, if your cerebellum is weak and you're discoordinated here, we can have you keep doing that till you get coordinated. That'll fire that cerebellum, that'll fire the opposite side of the brain, and that'll balance your nervous system. Now the other tool that we have is called neurofeedback. This is the greatest stuff. It's only been available in the last few years to be as good as it is because we now have computing power to use it properly. So what neurofeedback does is it lets your brain see itself in action. So we simply put a couple of electrodes with a little paste to your scalp and a couple to your ear, and then the software in the computer takes 256 samples per second of your brainwave activity, all the way from the lower frequencies to the higher frequencies. It takes all that information. It tells us when, it determines within split seconds when your brain is getting off its normal target, the normal path that it's been on. The best analogy is driving down the highway. You're driving down the highway, you get off to the right a little bit on those bumper strips. They're making noise, they're rattling your car, and what do? You steer back onto the center of the lane. Now if you got off on the bumper strips because you intended to pull off onto the shoulder, that's okay, you can still pull off onto the shoulder. And it's the same way with your brain. It can decide if it needs to correct itself or not. But once it gets out of its normal path, its normal focus, its normal present time moment, the computer, through mathematical calculations, determines that and alerts you through relaxing music that you're listening to, and there's an interruption in the sound of that music. It almost sounds like static on the line of the music you're listening to, but that tells your brain knows what it just did. It hears that sound, and it realizes, just like the bumper strips, oh, I can get back on track. And the more your brain learns to get back on track, the more efficient it gets, the more effective it gets, both in cognitive issues in terms of improving focus, improving memory, in getting over issues of depression and anxiety and things like that, but also in just helping your brain work better and control the organs better. The more efficient your brain is, the better it can control the organs. So that's called neurofeedback. So balancing the brain left and right and neurofeedback are the primary ways that we work with the brain. Fantastic tools. Now we also work with the body. And in working with the body, we're trying to get the right nutrients into the body and the right toxins back out of the body. If the body has a lot of toxicity, it can interfere with normal metabolic functions to a degree that cause you to have to take a lot of supplements or a lot of medications. When we can specifically target those toxins out of specific organs, and we can with the new technologies that we have, it can make all the difference in the world of your health. And then also we can figure out what nutrients we need to get into the cells for your health. And we also deal with diet as well, because most of us are inflamed in our bodies, we're inflamed in our brains because we have dietary issues that are driving inflammation. Too much sugars, too much grains, too many bad fats. They're all driving inflammation in our brain and in our body. And we can help you with diet to change all that, which is the foundation for the nutritional work. Then we can figure out how to get the right nutrients into the cells and get the right toxins back out of the cells. In figuring out how to get the right nutrients into the cells, we use lab work. We use lab work of various kinds, some that your typical physician uses and some that are more specialty labs to determine function in adrenal function and gut function and toxicity testing. But some of the standard blood labs, the whole system is set up on disease care ranges, which you have to be way outside the model to be flagged on those. But we look at a healthy range of those labs to determine where you want to be and help us determine what nutrients we can assist you with in the healing process. But there's some things that labs can't tell us. Labs can't always tell us what's going on in the body right now. They can't always tell us how certain things are impacting the body. And for that we use energetic testing. Energetic testing is a bit different than you've seen before, and you typically are not going to see it at most doctors' offices. But the only difference is we're not used to seeing it in healthcare, but it's the way our world works. And I want to give you a couple examples. If I get close to my house and I click my garage door remote, a signal goes through my windshield this thick, goes through 10 yards of air, goes through a garage door this thick, and my garage door opens. Now how does that happen? It happens because when I click this remote, there was a frequency sent from that remote that matched the frequency that was set in the garage door opener, and then my garage door opened. But my neighbor could come along, click his remote, and my garage door doesn't open. Why not? Because the frequencies did not match. We use that concept with the energetic testing that we do, both in the chiropractic and the nutrition and the toxicity work that we do. So it's all about frequencies. If they match the needs of the body, we can get a response out of the body. If they don't match the needs, we don't get a response out of the body. And so we use that principle throughout our healthcare. So you can say, well, Dr. Winters, that's just too crazy. Well, then it's too crazy for you to use your car remote or your garage door opener. My car remote, it's got this little tiny key, because keys are barely used. You almost always use the remote, right? So that's the way our world works, and we just apply it to healthcare. Now, in terms of getting the right nutrients in the body, we can test different reflex points on the body and determine where the energy is off in the body. For example, the liver, the kidneys, the bladder, the colon, the stomach, the heart. And that gives us lots of information. Those reflex points come from acupuncture and Chinese medicine over thousands of years. Again, we can take a strong muscle, we can touch a point. If the energy is off, there's a difference in frequencies, we'll get a response out of the body. That helps us tell gives us clues on what nutrients we need to get into the body. In terms of the toxicity testing, labs are very poor on toxicity in terms of telling us what nutrients or what toxins are really affecting the body. Now, I can do different labs on toxicity, and I've done lots of labs on toxicity, and I've studied thousands of hours on the issue, but I'm telling you the labs are poor in telling us what's actually affecting the body. And again, for that we can use energetic testing. We can take little vials of substances that come from homeopathic remedies of all different body parts, all different toxins and infectious agents and so forth, and we can tell what's affecting the body, what are the primary organs involved, and what are the primary toxins involved with that organ, and then we can make remedies to actually target specific toxins to be released from specific organs. It is phenomenal in helping us assist our health. It's going to be a little different than you've seen, but I'm telling you, it's on the cutting edge of where healthcare is going. Now, I also want to share with you how we work with the brain-body connection. And that's our chiropractic care. But our chiropractic care, again, is different, as you would expect, than most. We don't use a lot of twisting or popping of the spine. One, because we want to get real-time information from the body. I don't want information that's 6 months old on an x-ray. I don't want to just know if your joints feel locked up or not and move that, because your body may have a reason for that joint to be locked up. It might be a compensation. The problem might be really up here, and because it's up here, you can't go around the world like this with your head tilted, so your body has to compensate in your lower back. You end up having pain in your lower back when the real problem was here. You just had to adjust for it here so you could look at the world level. Just because it's locked up here, I don't want to necessarily correct that if the real problem is here. So we use real-time feedback from your body. And I do that through a method where we're checking the base of the skull here and seeing if we get a positive response or a negative response from a stimulus. That stimulus could be a physical touch of my hand, Or it could be a thought. I know that's crazy, but a thought is a frequency, and we talked about frequencies matching, just like my garage door opening. So if I give a thought that's a shoulder forward, I can see if there's a response out of the body or not. And then we can make an adjustment. And the adjustment is very gentle. This instrument taps 12 times per second. And so 12 times per second, that's moving those joints along your spine. That's firing information into those joints, which fires information into your spinal cord, which comes back out to the muscles, which also goes up to the brain to balance it. So a person never has to have any twisting or any popping at all to get a good adjustment. So what we do does the same thing as other chiropractic care. It just doesn't open up the joint far enough to make a pop. So we can be very gentle, we can be very precise, we can adjust you. I can go from adjusting an infant to an 80-year-old to a football player and use the same instrument. We also can work with emotions, because emotions are thoughts, thoughts are frequencies. We can have you think of something stressful. If we get a positive response out of the body when I'm checking you here, then we know that that emotion is stressing you, and then we can make a correction of your nervous system while you're thinking of that emotion, and it can really help your health. Now, we can adjust you again in many postures and many positions. So this is the brain, working with the brain-body connection. So if we work with the brain to strengthen it through brain balancing techniques and neurofeedback, we work with the body to get the right nutrients in and to get the right toxins out, and we work with the brain-body connection, we can make a tremendous difference in your health. Even though it seems simple, it's simple on the other side of complexity, and we've boiled it down to a formula, the winner's model of health restoration, which can tremendously improve your health. Thanks for your time today.